Throughout the assessment of the patient's arms, note their range of motion, muscle mass, and strength. To assess the vascular system in the arms, inspect the patient's hands. They should feel warm, and you should not detect edema or lesions. Next, check capillary refill time by depressing a nail bed until it blanches. Then quickly release the pressure. The nail bed should regain its normal color in 1 to 2 seconds. Palpate the radial and brachial pulses, which should be equal, regular in rate and rhythm, and strong, but not bounding in amplitude. Continue the assessment by evaluating the arm's sensory function. Follow these guidelines. Have the patient keep his eyes closed. Scatter the stimuli. Vary the pace. Compare distal and proximal areas. Compare both sides of the body. And map any areas of sensory loss.
Please close your eyes.
To assess for light touch, randomly touch a cotton wisp to the patient's arms and have him tell you when he feels the touch.
No. No. No.
To assess the patient's pain sensation, use a broken swab to test sharp and dull sensation. Tell the patient to identify the sensation as sharp or dull as you lightly touch his skin with the swab. Alternate the sharp and blunt ends of the swab.
Sharp. Dull. Sharp.
If the patient has trouble identifying these stimuli, assess his temperature sensation in a similar way using test tubes of warm and cold water.
Please close your eyes.
Warm. Cold. Warm.
To test the patient's vibration sensation, activate a tuning fork and then quickly place its stem over a distal bony prominence, such as a finger. Instruct the patient to say now when the fork starts vibrating and again when it stops vibrating. Perform this test in both arms. Normally, the patient can tell when the fork starts and stops vibrating. If he can't, test his vibration sensation more proximally. You'll also perform this assessment in both legs later in your exam.
No.
Good.
Next, assess the patient's position sensation. Have the patient close his eyes.
Down.
As you move one of his fingers up and down, instruct him to tell you which direction it is moving in. He should be able to do this accurately. If he can't, test this sensation more proximally in both arms and later in both legs. Now assess the patient's touch discrimination with the next 4 tests. The first test assesses stereognosis. Ask the patient to close his eyes. Then place a coin, key, or other object in his hand and ask him to identify it. He should be able to do this correctly.
Good.
The second test assesses graphesthesia. Perform this test if the patient has difficulty moving his hands. Trace a number in the palm of his hand and ask him to identify it. He should be able to identify the number accurately. The third test assesses 2-point discrimination. Randomly touch 2 sharp objects to the patient's fingertips and then gradually decrease the distance between the 2 objects.
2.
Note the distance at which he can no longer perceive 2 separate points.
2.
Normally,
1.
this is less than 5 millimeters. The fourth test assesses extinction. Touch 2 corresponding parts of the patient's body at the same time and ask him to show you where he was touched.
Correct.
He should be able to feel both touches and identify their location.
There.
Now test motor function by assessing the deep tendon reflexes. For each test, have the patient relax his arms. And remember to grade the reflex on a scale of 0 if it's absent to 4 if it's hyperactive. Start by testing the biceps reflex. Place your thumb on the patient's biceps tendon and strike it with the reflex hammer. Normally, this causes the forearm to flex. Next, test the triceps reflex. As you support the patient's upper arm, strike the triceps tendon above the elbow. This should elicit forearm extension. Now test the brachioradialis reflex. Strike the forearm 2 to 3 centimeters above the radial styloid process. This normally causes forearm flexion and supination. Finally, you'll assess the cerebellar function of the arms. To assess rapid alternating movements, have the patient pat his knees with his palms facing upward first and then downward. Have him gradually increase the speed of his movements. His movements should be coordinated and equal. Next, ask him to touch his thumb to each finger on the same hand and then to reverse the direction. He should be able to do these rapid skilled movements quickly and accurately. Then assess point-to-point localization using the finger-to-finger test. Have the patient touch your finger with his finger and then touch his nose. His movements should be smooth and accurate. Also perform the finger-to-nose test. Instruct the patient to close his eyes. Then have him stretch out his arms and touch his nose with one index finger, then the other, gradually increasing the speed. Again, his movements should be smooth and accurate.